Dr. Staffs. We're gonna go through an ingrown toenail procedure today. Do you want to show your face on our wonderful Instagram page?
Sure.
Say,
Hey,
you want to introduce yourself?
I'm John Toenail.
He is a trooper.
I am the victim.
He's a victim. He's gonna do great. We're gonna numb up his toe right now. Okay, my dear, it's gonna be a bit cold, cold, cold. Squeeze a little stress ball, okay? 1, 2, 3. You're doing really good. So what you wanna do is make sure you inject the base of the toe where the nerve is, and you'll see the skin puff up. You doing okay, John?
Yeah.
Good job. And our goal is to get this toe to not feel any pain and just pressure. So that's the first injection. And the cold spray kind of takes away the sting a little bit. All right, here we go. Cold, cold, cold. 1, 2, 3. Good job, John. Since you're doing such a good job, John, we got a treasure chest for you afterwards too, with toys and candies. Good, you doing okay? Excellent. We want to fan it in order to get the nerves to the toe. Good job. And the last one on the side. 1, 2, 3. Just to make sure that we don't miss anything. John, you are a champ.
The cold spray really helps.
Yeah, and that's it. And your toe should be numb. We're gonna give it a bit of time to fall asleep.
How was it?
Okay.
All right.
Ready? All right, this is Mr. John's beautiful orange toe over here for an ingrown toenail. What you want to do is always check for anesthesia. Make sure the patient's numb before you start. So I'm going to squeeze around a little bit. Is that pressure or is that sharp, John? All right, I'm squeezing a bit more. Pressure, sharp. Good. On this side, do you feel a bit of pressure? Is it sharp?
Nope.
Good. Are you neuropathic or with diabetes? Nope, that means you numbed it pretty good. Blood is good. Blood means that he can heal. Underneath there, I'm going to squeeze a little bit. Pressure or sharp? Excellent. And I can tell you've had this ingrown toenail for a while. You want to loosen up underneath the nail. Above where the cuticle is, you swivel out medially. Same thing on the lateral side. You do the cuticle. You go underneath and you have to give a bit of a push, but you always want to have negative pressure to allow for the spatula to proceed forward. You swivel out laterally, and then now we take the anvil, and there are 2 sides to the anvil. You want to get the pointy side, keep it down, and then you want to take off enough to provide the patient some relief. And you make your first cut before the cuticle. You always block it so you don't get blood in your eyes. And the second snip, you want to go underneath the cuticle. Good job. And then on the lateral side, same thing. You want to take enough to provide relief for your patient. Right before the cuticle, snip. And then you go underneath the cuticle and snip. You did great, John. This isn't hurting me one bit. You doing okay?
Yeah, I can't feel anything.
Good. You always want to lock your nail as far back as you can. You always rotate to the central plantar aspect of the toe. And he's got a tough ingrown that's been there for a while. I can feel it.
Oh, sweet.
There's the little guy. Trying to not make you faint by seeing your own ingrown that came out.
No, I won't faint. I want to see it.
And then we're gonna lock the lateral side. Always rotate and drop the hand to the central bottom part of the toe.
Nice.
All right, we took Fred and Ed out of your toe now, and all you want to do is make sure you remove any of the scar tissue that could be remaining on the toe, just to help him heal a little bit better. All this extra scar tissue from that chronic ingrown can cause him some pain and difficulty healing. So you just want to kind of clean out any of the residual scar tissue. There's a healthy wound base. What you want to see is that red base of skin grown nails over there. These are the little puppies that came out. You want to see, John?
I do.
So this is this guy over here, and this is this guy on this border. Awesome job, John, and that's it. Good luck.